Alright, hello. We will be presenting Zycadia. First, I'm just going to ask that you please hold all questions that aren't clarification questions until the end when we open it up for more difficult questions. Thank you. Next up. Okay, some terms to know before we start. So Zycadia is the trade name and serotinib is the pharmacological name. The cancer the receptor that Zycadia inhibits is anaplastic lymphoma kinase, ALK, and the cancer that it treats is ALK positive NSCLC, non-small cell lung cancer. Zycadia is a predecessor to serotinib. It was developed before serotinib, and I'm going to go into that a little bit in the next slide. Okay, so serotinib was FDA approved in April 2014. It is in pill form, and it treats, like I said before, ALK positive non-small cell lung cancer. And is only used when a patient previously developed a resistance to the other drug crizotinib. So first a patient will take crizotinib, and once they develop a resistance, they're put on serotinib.
So, like any other drug approved by the FDA, Zycadia had to go through the clinical trials. So, 59 patients were tested in phase 1, and they established a maximum tolerated dose at 750 milligrams with no dose-limiting toxicity. So, phase 2, 246 patients were tested, so now the study has expanded. And the scientists paid attention to the specific responses. 1, there was a 56% response rate. 2, there was a 7 to 8 month progression-free survival, which means that the metastatic effects of ALK positive lung cancer were halted for 7 to 8 months, and the overall survival median was not reached. Now, what's really important is that now, this is hard to believe, but there was no phase 3 trial. In order for the FDA to approve this drug, there was no need for a phase 3 trial, because the results were proven better than the predecessor drug, which was Zycadia. However, 2 phase 3 trials are currently going on right now. So, before I explain this graph, I just want to tell you guys what crizotinib is. I want to remind you, it's the predecessor drug to Zycadia. So, this graph represents the progression-free survival of Zycadia. So, 246 patients were tested, of which 183 patients have used crizotinib before Zycadia, and 83 patients have never used crizotinib before. Never used crizotinib in their life. So the y-axis represents the probability of progression of the disease while on Zycadia. The disease is ALK positive lung cancer. And the x-axis represents the time in months. What's really important, you have to notice, is that the number of patients at the 50% probability represents the median number of patients who have progressed. Remember, progression is a bad thing. So what I just said was, half the patients have progressed and half the patients have not progressed. So if you look here, the median time for disease progression of all the patients was established at 8.2 months. Now the blue line here, as you see, represents the 83 patients who have never used crizotinib in real life. So if you look carefully, the line has not reached the 50% probability. That means that no progression median was established. The reason this is very important is because the longer it takes for a progression median to be established, the longer the metastatic effects of any cancer, in this case ALK positive lung cancer, will be halted. So this is very important. So to make a small story short, the metastatic effects of a cancer are halted if the time for the progression median to be established takes a longer time. And all this data was recorded during the phase 2 trial of the FDA approval process.
So the ALK protein responsible for this form of cancer is created through a mutation called translocation. Can everyone put their 2 hands out next to the thumbs? Now wave your fingers in the air, you just don't care. Okay. Now translocation is when, and the fingers that you're waving right now represent nucleotide bases of DNA. So translocation represents the mutation in which the base pairs are flipped, and now the order is changed. This mutation is responsible for creating the ALK protein, which is responsible partly responsible for this form of cancer that Zycadia addresses. So ALK triggers a very specific cell cascade, as you can see right here on this diagram. So ALK, using the cell cascade, through the cell cascade, triggers cell cycle progression at a rapid pace. So when it's bound to a ligand, it speeds up faster. And that leads to cancer, or is one of the contributes to cancer. So to summarize, activation of ALK leads to the activation of the cell cascade, leads to the contributes to the spread of cancer through rapid cell cycle progression. Now, how Zycadia interacts with this, how Zycadia interacts with the cancer is Zycadia binds to ALK. So when it is bound to ALK, it alters the pathways that originally led to cell proliferation. Now, there are three main pathways that it leads to. The MAH kinase pathway, P1-3 kinase pathway, and the JAK-STAT pathway. So the JAK-STAT pathway is responsible for, now altered by Zycadia, is responsible for inducing apoptosis in the tumor cells. The other two, MAH kinase pathway and the PI3 pathway, P1-3 pathway, sorry, what the P1-3 is PI3. The PI3 pathway are responsible for decreasing proliferation to help address the tumor. So to summarize this one, Zycadia stops tumor growth by binding to ALK, altering the pathways, and so that the pathways lead to decreased proliferation and apoptosis. We got this beautiful diagram right off of Novartis' website. Smiley face diagram.
Any questions about mechanism so far?
Yeah, we have some time, so if you have a question.
What do you mean by altered pathway? Okay, so on the last slide, this is the pathway of ALK with a ligand. So this is what would happen if Certinib was not bound to ALK. So Certinib is actually a competitive inhibitor. So it binds to the ALK before the ligand can. So it alters the cell cascade and makes it this one instead of the previous one. And this one is decreasing proliferation. The other one is increasing proliferation and spreading cancer.
What part of that makes it decrease proliferation instead of increasing?
So, as I said before, the MAH kinase and PI3 pathways, they're altered to decrease proliferation, whereas them and along with the pathways in the original diagram we showed you led to proliferation.
So does Zycadia only decrease the proliferation, or does it actually stop?
It does. By decreasing proliferation, it slows down tumor growth drastically, and it also induces apoptosis in the JAK-STAT pathway.
So to answer your question, next slide. The Zycadia fights tumors, and it's a neutralizer and reducer. So on the figure on the left, this is a 48-year-old man's lung, and in the left lung there are three prominent tumors. And this is before he received treatment of Certinib. After, here, you can see the tumors are gone. So usually, doctors look towards surgery. So as soon as the Certinib neutralizes the tumor or has it stopped growing rapidly, they'll have surgery to remove the tumor and not wait for the apoptosis signal to kill the whole tumor. It's just much safer and more effective. Any questions? Yep.
So the drug is more effective and safer than surgery?
No, it's you have the patient will have surgery once the drug has neutralized the tumor.
So Zycadia neutralizes the tumor by slowing down its growth and inducing apoptosis. So that doesn't totally get rid of the tumor, and then a surgery is needed afterwards to remove the tumor from the body.
Yep.
Is there anything administered after the surgery? Zycadia or no?
We didn't read anything.
We didn't read anything about that, but we can look at it.
Okay, that's it for this slide. Okay, some strengths of Zycadia. it's very specific and it's a targeted therapy. So only 2 to 7% of all lung cancer patients have this ALK positive non-small cell lung cancer. So it's very effective, but it's only for this certain group of patients, which is, as you can see, also a weakness. Another strength has a very good ORR, overall response rate, and as Neil said, progression-free survival. Another weakness is the dosage. Although it can go higher than it did go higher than 750 milligrams per day. If the dosage is too high, improper dosage can cause many worse side effects and also add to the side effects list. And some of them can be very dangerous. Any questions? Yeah. What side effects? So the normal side effects are like nausea, fatigue, abdominal pains, internal gastrointestinal, like all that business. Yes. But the worst ones are like increased glucose, increased bilirubin, and what was that? Increased creatine. And that's it. So any questions you can ask?
What are bilirubin and the other one called? Do you guys know what it causes?
Yeah. What was that?
No, so no, we're not exactly sure what it is, but we know I'm pretty sure that bilirubin is yellow substance found in the bile.
It is. So it turns. So the effect of it. So it's an increase in. So the liver's creating too much bile for sure, and your eyes turn yellow, and your skin turns a little yellow, and just jaundice.
Okay. Just we'll go to the beginning. Any questions specific to the phases and clinical trials?
You said that there was no need for phase 3 trials, but they're conducting phase 3 trials. Can you clarify that?
Yeah. So the reason why there was no need for a phase 3 trial during the FDA approval process was because the results of the Zycadia were better than the results of Zalcarai. But now they're doing phase 3 trials now to put on the record that they have performed a phase 3 trial.
But they are FDA.
They are FDA.
They're also, yeah.
Can you move forward to mechanism? Questions here?
Next slide. So just to get cleared up, so that inhibits ALK, which activates all those pathways. That's why there's the proliferation. It doesn't actually alter the pathways.
Well, okay. So if you go back to the next slide, you can see some of the pathways are the same. So it's like PI3K, JAK-STAT. So those are altered. But like these are also these don't work anymore.
And you must also know that these 3 pathways are found in all normal cells. It's just that the okay.
Yeah.
Okay, so JAK-STAT is leading to apoptosis, but RAS is leading to cell proliferation, while PI3K inhibits proliferation, right?
So two negatives is leading to cell cycle progression, but it's in the net with serotonin inhibiting the ALK. So this serotonin is taking place of a ligand that would be here,
Right.
So with the serotonin there, it alters these pathways, and instead of promoting cell cycle progression, it's decreasing the proliferation.
Yeah, and
So I'm sorry. So RAS, RAF-MEK, that is a cell proliferation pathway. Activation of RAS, RAF-MEK. It's the second one from the left.
Yeah,
when
right.
you say RAS, it's like basically
Yeah.
Right. So we see we're directly activating cyclins and we're going to cell cycle progression. Right. Okay. And JAK-STAT is sending the cell into apoptosis.
Anti-apoptotic proteins.
Anti-apoptotic.
Yeah, because what the JAK-STAT pathway does, that's the pathway responsible for bringing a signal from outside of the cell to the inside of the cell. If serotonin is blocking that ALK receptor, the ligand, which has the signal, cannot be transferred into the cell.
I'm sorry, maybe I missed something in your following diagram. So you're saying those three pathways are blocked?
No, these are active. They are the same. They're not the same. Sorry, they're not the same as the ones on the previous slide. They're altered because in the other slide is a ligand, but now it's serotonin, which is going to induce different pathways.
So the signal cannot go through, and the other two pathways are going to receive different signals. So instead of cell proliferation, there's going to be decreased proliferation.
So it's like there's two. Okay, so there's two different inhibitors,
Right.
ligand versus serotonin. Since they're different, they're gonna induce different pathways.
But they bind to the same thing.
So to get this, if this isn't inhibiting the pathway that's already there, it's activating something completely different. Is that what you're saying?
So this is the ligand. No, the ligand attaches to ALK to make this happen.
Okay, the normal wild type, normal situation, we bind to ALK, we get cell proliferation via RAF, MEK, and JAK-STAT, and PI3K.
Okay.
Right, got it. Okay, so
Should we elaborate?
serotonin.
Different than the ligand. Well,
Serotonin is Zycadia.
yeah,
Zycadia.
will induce a different cell cascade because it's different than the ligand.
If you look at
Which cell cascade does it activate?
Activates all three.
All
That's
three.
the same. That's the same one.
not all the
So the two. Do you guys see where I'm confused?
Yeah.
Can someone else ask the question?
Yes, please, somebody else.
Okay.
Anybody?
So
Yeah, Alexa.
theoretically, RAS, RAF, MEK, and ERK generally lead to cell proliferation. That's the path. That's generally what the pathway is.
When ALK. With ALK.
Yes. So with the serotonin, with the Zycadia,
Yeah.
we would think that would then, by binding to the ALK, it's then preventing the ligand from binding, which means it's inhibiting the rest of the cell cascade from occurring. But you guys had said that it activated a completely different cell cascade, meaning that a bunch of different things got activated.
Right.
What are those things?
Okay, so it's not. Alright, so now I go. So it's not a different cell cascade. That was a mistake. But it is. There's a different end result of the cell cascade. Is that what you?
Yes.
All right. So yeah. I'm sorry if one of us said that.
Got it.
Yes, John.
So you're making these enzymes perform different functions when you add serotonin to it?
Yeah. Pretty much.
Yes? Okay.
But they activate the same signals, they just, that those signals have a different result.
They're not all the same. So like some of them aren't included. I'm not sure. I'm not sure. Yes,
There is
Can you go to the next slide?
This graph was found on Zycadia. We just redrew it.
If you're inhibiting the ALK, won't it not go through any of the pathways?
No, because it's different because when Zycadia binds, it changes the influence of the pathway. So it's not like it completely shuts the pathways off. It actually goes through the pathways, but it changes.
Okay, we gotta go. When do we have our next class? Monday. All right, your homework is going to be to watch this presentation again. We will discuss do's and don'ts.